What happens if your health data falls into wrong hands? Imagine someone accessing your diagnosis, your prescriptions, and even your sensitive lab results without your consent. It's not just a privacy concern, it could lead to identity theft, insurance denials, and even more serious consequences. That's where the HIPAA privacy rule for de identification comes in. So, here I'm not only covering de identification today, but I'm also sharing a very simple and a cost effective way to be HIPAA safe. So do stick around if you also are interested in this simple technique. If you are building a health app, working with electronic health records, or doing clinical research, this video will certainly help you stay HIPAA compliant because I'm sharing a sample Python code from my Git repository to help you de-identify and re-identify PHI if required. So let's get started here. Hi, I'm Manmeet Chadha, and here on Health Tech Decoded, I clarify all your queries related to healthcare technology. Let's first understand what de-identification does. It actually removes the PHI identifiers from the patient health information and it mitigates all the privacy risks. That's how it allows the use of health data for the purposes of comparative studies, life sciences research, clinical trials, or even AI training models using health data. Per the HIPAA privacy rule, there are two methods for PHI de-identification, expert determination and the safe harbor method. Expert determination method here, a healthcare expert evaluates the risks based on PHI in the dataset that is being de-identified. Then this expert applies statistics to find any kind of links between the provided dataset and the broader population dataset available. Just highlighting an example which is very well explained on the Department of Health and Human Services website. Here you see that the patient data set on the left side, even though does not have the name of the patient, but still can easily be matched by someone who has access to the voter ID data of that geographical location. That is why if any links available, the expert should be able to determine those. Then the expert should also be able to analyze the audience that are intended to receive this patient data set. And if risks involved, the expert should be able to provide mitigation suggestions using various methods like suppression, generalization, and perturbation. For example, mitigation by suppression can involve removing PHI values from some records or even removing the entire record in some cases. Then, generalization of data, like age groups or zip codes, can also help in mitigating the risks. Then, perturbation, it involves replacing values with equally specific values. So, for example, all ages incremented by 4 years or all zip codes, they changed with plus or minus 3 of the original zip code values. Then at last, the expert determination method should also include documenting the expert's opinions. Now after expert determination, let's understand the safe harbor method. This method de-identifies or removes the PHI identifiers, for example, IDs, codes, names, date of birth, etc. Then here the keys are to be maintained during de-identification in case they are required for re-identification later. With this method, the zip codes can use the original first 3 digits only if that geographical area it contains more than 20,000 people. Else we only use 000 in zip codes in the first 3 digits. Then data can be re-identified using the keys if required, and the re-identified data is considered PHI. So these are the two methods we just saw, and they should be used when it comes to de-identification of PHI. You should follow any one method if you need to be HIPAA safe. Here I will more focus on the safe harbor method, and I will share a small Python framework which I will use for de-identifying PHI identifiers in X12 files. I'll also show you how to re-identify them back. But first let's understand this framework with the help of a flow diagram. As you see here, I mapped the X12 files to XML files for ease of use. The de-identifier Python code masks the XML tags based on the masking rules for the chosen PHI identifiers. These de-identified XML files are converted back to X12 files which are not PHI anymore. Then, if ever re-identification is required, the X12 files are first mapped to XML, re-identified based on the mapping keys that were created earlier, and finally resulting in re-identified XML or X12 files which now again comprise of PHI. So let me show you the Python X12 handler framework that I utilize for de-identifying and re-identifying PHI in my X12 files. you see the folder structure here. It has the folder called data, then the parser and the rules. The folder data has all the XML and the XML files, the input and output both. The parser has all the Python libraries and the code that would actually validate the XML files, convert them into XML, and then de-identify them based on the rules that are available in the rules folder, and then de-identify them, and whenever needed, re-identify them. The README file has all the details about what all steps you should take and what all libraries are required. One important thing is that I utilize the PyX12 library here. PyX12 is a library that you can just do a pip install. It's a very handy library for validating your X12 files and even converting your X12 to XML and back to X12 whenever required. So the X12 file that I'll utilize here would be the 837i sample to X12. Let me show this file to you first. So this is the file, and I want you to always utilize stedi.com, a very handy tool inside stedi.com is called an EDI inspector. You can log into stedi.com. You can create an account login, and the EDI inspector is in here. So I usually paste my X12 contents on the left side, and then it does validate. It says, okay, my file is valid. You see on the left side, there's a tick mark. Then on the right side, it does show all the segments comprised of in my EDI file. So in this case, there are 2 or 3 specific loops that I'm focusing on because they do have PHI. And it's the 2010 BA loop and the 2010 CA loop. So the 2010 BA loop is here. This is the 2010 BA loop, which has the subscriber information, and then the 2010 CA loop has the patient information. So I'm focusing on actually masking all this information, the PHI. Now let me also show you the masking file here, which is required to actually mask your data or de-identify your data. So in this demo, it will be utilizing this loop information, So I'm masking the address, first name, last name. This is for the subscriber and this is for the patient. Then I'm also masking some provider and payer information, though it's not PHI, but still for the sake of convenience, I'm masking. And this masking file I utilize both for 837 and for my 835 maskings. So that is why you would see a few of 835 segments also in this masking file. This is the shell script. You'll get it on GitHub also. This is the shell script that actually picks up the X12 file. It runs it through the PyX12 library. It validates it. It would convert it to XML. It would de-identify and then again convert it back to X12. So here, before I run this command, I want to highlight that under X12 files, there's no folder called de-identified yet because I've not yet de-identified any file as the purpose of this demo. But now, since I'm going to do that, so you see there will be a new folder created here. Okay, a de-identified folder is created, and the input that we gave is now de-identified, and that's the output. Let me show this file to you also. Here you see this file on the right side, which is the output file, and the earlier one was the input file that we had copied. I want to show it to you side by side. This is the de-identified information. On the left side, you see the input with PHI. On the right side, you see the output, which is de-identified. The PHI is all de-identified. So if you want to share this file now with anybody outside, yes, we can, because all this information is de-identified. Now, this is how X12 or HL7 files can be de-identified when required to be utilized for research, trials, or even digital transfers. There could be a requirement for re-identifying the mass data. For example, during research, it was found that the patient lab results are not satisfactory and should be conveyed. In that case, the PHI identifiers should be re-identified, and let me show you how to re-identify them. So for re-identification, the main file that's utilized is the mapping rules file. The mapping rules file, as you see here on the left side, it's highlighted here. This is the file that gets created when we are utilizing this framework for the first time. Rest every time, this file just keeps getting updated with respect to whatever PHI fields that are being de-identified. So when we did that demo, the de-identification demo, this file was updated, and on the right side are the PHI fields, and on the left side are the de-identified values of those PHI fields. So for example, 07302 was the original zip code, which was de-identified to 07355. Similarly, New York City was de-identified to the redacted patient city, etc. This file will now be utilized during the re-identification process, and the values that were de-identified will be replaced back to the original values. This is the command that I'm running, and a new folder called as re-identified just got created here. And this is the re-identified X12 file that gets created. Let me open this file. This should be exactly same like the original file with which we had started the de-identification process. Okay, so let me change the color here so that it's read properly. Here, this right side was the file that I had shown you just now when we had done the de-identification. All the redacted data was here. And now on the left side again, I just now opened the file that was re-identified. So now I have received the original data back. So now you understand how you can utilize this framework in a cost-effective and a very quick way to de-identify and re-identify your PHI. So do give a thumbs up and subscribe to this channel if you are interested in such content. And in case you want to understand HIPAA in detail, do check this video out.